Awesome. So will you please give your full name
Sure. My name is Laurel Witt,
and then your present title?
MD,
All right. And where did you go to medical school?
University of Kansas,
Okay. And then where did you complete your residency?
Oregon Health Sciences University.
All right. Can you speak a little bit about your current positions and then what you do on a daily basis?
You bet. Right now, I work as faculty at the University of Kansas School of Medicine. I provide both outpatient and inpatient family medicine care at the hospital and the clinic. Um, I also spend a good deal of my time in education and help direct the clerkship in family medicine on the Kansas City campus. And a good deal of my time goes to that, in addition to some curriculum in the first and second year through lectures and small groups.
Can you tell me about the patient population you take care of in Kansas City?
Sure, we take care of, I think family medicine in Kansas City feels accountable to its community. And so we look to take care of uh, citizens of Wyandotte County. We know that we take care of folks from the greater metro area and beyond. Um, uh, we, I think we have a good mix of patients. We have a gambit of ages. I don't provide obstetric care anymore, but many of my partners do, and we take care of babies. And we also have partners who have geriatric fellowships. And so we have a good range of ages, I think, in our practice. We also have a good deal of medical complexity, which a lot of us enjoy. And one of my personal favorites is working with people to achieve their wellness goals in the context of medical complexity.
Great. So next, we're going to talk about kind of COVID and how that's affected your life. Can you kind of talk about how this has impacted your current work?
Yeah, absolutely. I think it's been a tough year to say the least. I think I was reflecting a little bit on it's been nearly a year, right?
Yeah,
And
almost 1 year.
yeah, what what last March was like and what this March is like, quite different. And this March we're still obviously dealing with masking and distancing and some great uncertainty around variants. But vaccination is a game changer, and it allows us to be, or it will allow us to be around our families and friends and colleagues again. Last March, last March was different. We had so much more uncertainty. We didn't know what this was, right? We didn't know how to protect ourselves. We didn't know how to protect our patients. I remember the first time I walked into a hospital room to take care of somebody with this virus, and we tried to know as much as we could, and we still had more questions than answers. And that felt, well, I just won't ever get over that feeling of doubt and inadequacy and not being able to take care of someone or save them. Um, and in fact, I will think of that person for the rest of my life, and she will be the person, the face that represents this whole year for me, this whole pandemic for me. And we have taken care of many more people with the virus since then. And she was sure important for me. I think when I think about my experiences over the last year, she helps me come to peace a little bit with how much we've grown and learned, and and hopefully we've gotten better um, as a people, as a group.
Yeah. So what unique challenges did you and your practice face regarding COVID-19?
Like many practices early on, we shut our doors, our clinic doors early on, and did so for several weeks. I'm trying to remember how long, and I can't pinpoint when we physically reopened, but we learned how to do telemedicine overnight. Um, at first, we were using Doximity, we were using Zoom, whatever we could get our hands on, and formalize some processes pretty quickly. And many people like myself who felt rather technologically behind were trying to ramp up and learn things. We kept providing hospital care throughout that time. And so it was a mix of sometimes some days being at home, seeing patients, and some days going into the hospital, which was weird to get used to.
Yeah. Can you speak about the challenges you faced in your position as a clerkship director or your role in that in the education side of things?
You bet. You bet. Boy, we've learned, I think, a lot in medical education this year. The obviously a top goal is to keep learners safe. These are going to be our physicians of the future, and we care about them immensely. And so the first decisions we made were to close campus down. Um, in hindsight, we, I think, have learned that it is perhaps even as important to keep learners progressing, because in less than 2 years, this level where I teach, they're going to be practicing physicians and deserve to be in the clinical environments. And so this has changed everything I do about medical education. Everything the clerkship is about now is about getting getting learners in the clinical environment as much as possible. Everything else is secondary. A lecture, um, things like that are all secondary now. So we did a lot with remote education,
Mhm.
especially at first, and we learned that it has many failings. It's always better to get together to practice and learn things, but there's also some benefits. And so we'll be doing some teaching through remote modalities, I think, for the foreseeable future.
Yeah.
Where I think where I think we can't do that is in the really complex team practicing complex problems, working with an expert, being there with them, and then also the coaching piece. I think as we coach each other through this profession, being face to face is pretty important.
Yeah. What are some of the pros with using technology as kind of a supplement in education?
You know, that what we've learned is that it provides both learners and teachers a great deal of flexibility. Um, for example, we used to not be able to access some of our great teachers who are our busiest clinicians and busiest leaders, because we really couldn't ask them to come give a recurring didactic every 2 months as we roll over the clerkship. And now we can do that with a lot greater ease. So I think our learners will have better access to more teachers. Um, I think that too, it's important to realize that learners and physicians alike have families, and learning from home can be a really attractive plus and you could learn asynchronously. You can learn when it makes sense for your family and your work. And that's a real benefit. Um, we studied this a little bit in the remote clerkship that we did, and we learned that actually far more learners had technological difficulties than we expected, in the form of mostly internet interruptions, but also in the form of personal obligations outside of the medical school curriculum. So childcare, care of an older parent, or something else that if we were doing live remote sessions all day long, they certainly got interrupted by. So,
Yeah. How did you manage professional life and personal life during COVID?
um, by the seat of my pants.
Fair enough.
Oh, it was just really making it up as I go, because it just seems like everything changed month by month or week by week. We were home in the beginning, and then we were a hybrid, and then we were trying to do, yeah, I think that I owe a lot to my partner, and I owe a lot to my kids, because they've really changed their whole lifestyle so that I could do what I do. We would isolate from everybody else for weeks on end after certain exposures that I had, and I think about my 2 and 4-year-old, and I know that affected their development, and they have just been bright, exciting, developing kids despite that, and my partner is the same despite juggling work himself. So I feel really grateful, and our relationships are strong, and maybe that's a good outcome to come from all this.
Yeah. So what's the most important thing you've learned through this pandemic? If you could pick one thing.
No way, that's hard. There's been so many lessons, right?
Right. Yeah. And you can name two if you need to.
Thank you. Um, I guess um, I think I've really had reinforced that community medicine matters, that being in community, providing care in a socially accountable way, in a family medicine way, I think I'm where I'm supposed to be. And sometimes things get hectic or distracted or burnt out, but it's important, and I've seen that. That's been that's been a good thing to learn.
Yeah, I would agree. If you could do the past year over, would you change anything that
Mm,
you've done or that you've seen done?
that's a good question. That's a good question. Hmm. I don't know. I think that one of the things I didn't do well in the beginning was take care of myself very well, and I stopped exercising, and I stopped sleeping, and I won't do that again. So that has been a real great lesson on self-care and wellness,
Wow.
that we can figure out how to fit those things in, and should. Um, that's probably been the biggest thing, because you know what? We did the best we could with everything else. We protected ourselves as well as we could, or as well as our supplies would allow, and we took the best care of patients that we could, and we read constantly and supported each other, and I don't have any regrets about those things.
Yeah. Was there any one particular person that impressed you throughout the pandemic?
Yeah, I know immediately who that is. I have lots of people who've impressed me throughout the pandemic, but
Yeah.
my good friend and colleague, Dr. Erin Corvo, who's a family physician and one of the public health officers of Wyandotte County, which is where I practice, um, has been an enormous leader in our community, um, has been a forceful leader when needed, has been organized, and I think she's brought great clarity to the planning there. Her work this year has been so important and second to none.
Great. What changes brought by COVID-19 do you think will be permanent?
Telemedicine will be permanent, which is great. I think that's a really lovely thing for patients. Um, I think that Zoom meetings are here to stay.
Yay!
Ooh, I certainly hope the muffins at faculty meeting come back, because I miss those. But what else is here to stay? I think that greeting people without a handshake is here for a while. I'm not sure how soon that'll come back. But
Yeah.
those are the things that come to mind first.
Yeah. You've already mentioned some things, but is there anything else you see that COVID's impacted the learning of students and residents, especially in family medicine?
Yeah, thought about this a lot this year. Um, we have had restrictions at our hospital on where students can go even now, and so I think about following um, the students who are now fourth years. At the end of their third year, they had to spend their last rotation at home. So those who are on OB, for example, may not have delivered a baby in their third year. And those who were on surgery certainly would have participated in surgical procedures on their OB rotation, but would have missed out on key skills. And I think that extends to whatever they may have missed in that last rotation. And then as they progressed through fourth year, we have not allowed them to go to the ER to admit patients due to spacing issues in our ER. Many students have not been allowed to take care of laboring patients if their COVID status is unknown. And as of yet, admitted patients who don't have a COVID test back, we have prohibited students from seeing. And so the whole process of admitting a patient from the start gets interrupted. So I think these are real interruptions that have potentially long-lasting effects. I think there are plenty of ways to correct them, and those might come in the form of boot camps in the intern year, or in the fourth year once we do get access back to those critical areas. There's probably a lot of ways to do that, but I certainly think we should pay attention to that.
Yeah. What is your sense of where family medicine is going in the future?
I think family medicine is poised to be community medicine in new ways, to really include all patients in ways that other specialties might not be. I think we are poised to understand, incorporate, and address structural determinants of health and disease. We're ready to incorporate those and problem solve. I think we listen well, and we're ready to listen to those lessons that have to be reckoned with and have started to be reckoned with. And I think that's a really exciting place for family medicine to go. It's obviously going to stay important as a member and role player in the health system. And I think it's going to bring in these new skills and just kind of broaden up, hopefully bring in real, I don't know how to say it, but the care of all people in better ways.
Yeah. So are there any views on important issues in family medicine related to COVID-19 that you haven't addressed or that you'd like to add to this conversation?
I don't know. I guess it feels pretty good to be a family physician at this point. It's been a tough year at times, but it's reinforced my choice to become a family physician, for sure. So.
Okay, well, I'm going to end there.